Gloria, tell us what's going on with your ankle.
I came back from surgery on pain meds and I rolled my ankle. That was May 26th, and it swelled up, had a lot of pain, very unbearable. And since then, the swelling in the ankle has gone down and I don't have any swelling anymore in my feet. But I still have pain now. It's at the ball of my foot and on the second toe. So it hurts me to stand long or to walk any length of distance. It hurts. I can't tiptoe. I can't wear heels. And I have to limp most of the time.
The surgery was not related to your ankle?
No.
Yeah, okay, so that was something else. And how much pain do you feel there from 0 to 10? 10 is emergency room when you walk on it, or
when it's really bad, it's like a 7.
7 out of 10. But okay, so I want to see how you walk and tell us how much pain you feel while you're walking.
Okay.
You're just normal walking back and forth here. Come here.
Okay.
Is that your normal speed? You're limping for sure.
I am limping because
Yep,
it hurts.
because it's hurt. How much pain from 0 to 10?
Right now, because I'm limping, it's probably like a 3, 4.
Okay, but if I let you walk a little bit longer, that will increase?
Yes. Yeah, the
Okay.
more walking, the worse.
Let's do one more time, walking
Okay.
back and forth. So you've been limping like that since May?
Pretty much, yes.
Okay.
I was in a wheelchair. I was also in a wheelchair because I couldn't walk in it for how long? A good couple weeks.
Oh, wow, okay. All right.
Yeah.
So when you're ready, I want you to lie on your back, head over there. So I'm gonna work on the ankle. Okay. So as I told you, everything should be pain-free, okay?
Okay.
Make sure you let me know if you feel any pain.
Okay. So pain is not good.
Yeah, pain is actually, if you feel pain while you're receiving treatment, that's a damage to the healthy tissue.
Okay.
Pain is like a check engine signal.
Yes.
If you ignore it, you're gonna have more damage. If we address it, we can fix it.
Okay. Oh, that's
why-
good to know.
That's why I disagree with the philosophy, no pain, no gain. It's
Right.
actually cause more damage than benefits.
Okay.
Okay. Hold it up, and relax so you go. Up. Hold it up. And relax so you go. Okay, so you can do this one. So it's all in here, yeah?
Yes.
And that's painful?
No.
That tender here?
No.
This
Oh,
is
yeah, that one.
here, yeah?
It was more the side where you squeezed.
Yep.
Uh-huh.
Okay. So it's gonna feel cold. Let me know if you feel pain with that, okay?
Okay.
All right. Relax. Okay. You hear that crunchiness?
Yes.
That's a lot of scar tissue. Relax.
Okay.
Okay. So you get a lot of scar tissue there. Okay.
Yeah, I can feel that.
Is it painful or it's okay?
It's just a tiny bit painful.
Okay, relax. Relax. But sure, you let me know, okay?
Okay.
I cannot read your mind.
All right.
Not today.
That would take too long anyway.
Yeah, I'm working on it.
I couldn't believe it. I've never gotten sick from a flu shot, so they always say that you can't get sick from a flu shot. If there was something that you had.
Is that too much or it's okay?
It's a little painful.
So why are you not telling me?
Because I'm thinking if I am, it's the old mentality. If
Yeah.
you can break it down and work through it.
Well, if you feel pain, that's a damage to the healthy
Okay.
tissue, and that's gonna cause a new scar tissue. We don't want that.
Okay.
We want everything as comfortable. Okay. I made a mess. Okay.
We already made the
Relax.
Friday. You did. Last Friday overnight.
You hear that grinding? And,
Yeah.
Yeah, that's a lot of scar tissue.
I feel a lot of stress on my shoulder, and so when I get really tight and tense, I'll use it.
Okay.
I have to lift a lot of my hands.
So after that, I will have you walk again and tell me how much pain do you feel now, okay?
Okay.
Okay. Put your shoes on. And I want to see how you walk in here. Just normal walk. How's that?
feels better.
Any pain or it's gone?
There's a little bit of pain in my toe still,
Mhm.
but it's greatly. Oh,
Decrease?
that feels much better.
Mhm.
Yeah,
Yeah.
that is much better.
Mhm.
Wow, it's just in the toe now.
Where is in the toe?
In the back of, just in that second toe, right in here.
Okay, let's line your back.
It's so much better.
Mhm.
I can't believe
Magic.
it. Wow.
Just don't crush your glasses.
Yeah. Then that would be another injury.
Yeah. Relax. So this is the area, yeah?
Uh-huh.
Mhm. Right in here, you feel
Yes.
it? Relax.
Okay.
Okay, relax. You feel the scar tissue there, the crunchiness?
Yes.
Yep, you get a lot of scar tissue.
Would that be from the tendon? being
The scar
injured?
tissue is part of the healing process with any injury. It's it's essential for our survival. The problem when we have too much scar tissue that's compressing on the nerve and artery. So we have to manually break it down, otherwise it's gonna cause a lot of issues. Let's walk back and forth and tell me how that feels.
Oh, yeah, that does feel better.
Mm-hmm.
Cover pretty quickly, or?
It's gone or you still feel it?
Just, yeah, the toe still.
Okay, let's drink some water. We'll break scar tissue and release the toxins in most product. Make sure you drink your water. Finish this cup and I want you to walk again and tell me how that feels.
It's cold.
Okay, you don't have to finish the whole thing.
Okay.
Okay, so let's walk back and forth and tell me how that feels.
It's better.
Mm-hmm.
Much better. Oh, yeah, I don't have to limp.
Mm-hmm. Beautiful.
Yeah, I don't have to limp.
That's good. Thank you so much. Thank you.
Thank you so much.